Thanks, Jack. Well, we're here with a woman that I called the rock star earlier today, our head of our Department of Health, Sigalle Reiss. Sigalle, how are we doing?
We're doing pretty good here in Norwood. We only have a handful of cases every week. We do post them on the website, so anybody that wants to know what our data looks like, it's posted every Wednesday evening on our website. But just a handful, 4 or 5 cases every week we're seeing.
Now, how about at the statewide level? Is it starting to trend up a little bit? What are we seeing there?
Sure, yeah. Statewide, we are seeing a little uptick in the daily case count. Listening to and looking at the data, it looks like those upticks are really in some hotspots around the state. Most communities like us are seeing really a low-level amount of daily or weekly cases. But there are some hotspots, and the state's doing a really good job because they're actually focusing a lot of their testing and energy in those areas, which you want. And as I've said throughout this whole process, the more you test, the more you're going to find. But that's a good thing because the more cases you find, the more you can isolate and quarantine and stop the spread. So I really think that uptick is really because we're testing in some hot spots.
So with the flu season coming up, are we thinking that that's going to have an impact on this? And I'm going to kind of throw in another question about how we're going to handle flu season here in town at this point too.
Sure, so let me deal with that first part. Flu is definitely going to complicate everything. Every year flu has a dramatic impact on our healthcare system and obviously public health. And the symptoms are very similar. So we're going to start to see as we go into the fall, people coming down with flu, typical flu that we see every year. But because it's so similar to COVID, it's going to really complicate everything. And everybody that gets those symptoms is going to have to be tested for flu and COVID. So flu is definitely going to complicate that. And that's the community sort of public health view. Also from the healthcare perspective, when we know that some hospitals are going to start reaching capacity and things like that, flu is only going to add to that and exacerbate that issue because we see that increase in cases every flu season anyway in hospitals. And the second part of your question about what we're doing, we actually just had a meeting this morning thinking about how we can do our flu clinics differently. We're not going to be able to pull mass amounts of people together, line them up and give those flu shots like we usually do. So we're looking at a bunch of different options, appointment-based, looking at drive-through, but don't think that's really going to work for us. I think we could really stagger the crowds and do it appointment-based and little by little get out our vaccine. I think what's really important for everybody here is it's that much more important this year to get your flu vaccine because we need to bring down those cases of flu so we can continue to concentrate on COVID.
So basically, people don't have to worry. The town will be there for flu shots again, but we'll have to do it in a little bit, just like everything else, a little bit different.
Exactly. We'll definitely still be doing our flu clinics and doing outreach. We'll probably look at the end of October, early November when we'll start doing the big clinics, and really want to stress it's important to get your vaccine this year.
So as we pivot from summer into fall, school is going to be starting, and I know you've been very involved with Dr. Thompson and the team in the planning for that. How are you feeling about that, and what do you think parents should know or be concerned about or not be concerned about?
Yeah, sure. I think it's a very complex system, our schools, and I think I've worked very closely with Dr. Thompson and also the chair, Teresa Stewart, who actually has her master's in public health. So that's a great value add that we have on our school committee, somebody that has a public health background. They're really in a tough position. Just yesterday, the governor came out and said every low-risk community should really have full in-person school. But when you look at the guidance and the safety precautions that they have to take, it's literally impossible. The school committee and Dr. Thompson and really, all his staff are working really hard to try and make it work. But it's a very complex system, and they have very stringent guidelines that they need to stick to maintain safety, as they should. So I really feel like the schools are between a rock and a hard place, and there's no good answer, and people are gonna be upset no matter what the final decisions come out to be. It's very difficult. So I guess I say to parents and the families to be patient, understanding, and just like everything we've experienced with COVID, it's constantly changing, and we just need to go with the flow and adapt and do the best we can.
So again, let me just ask you a little bit about right now. The governor the gatherings have gone down to 50, is it? What other things should people know?
Sure. So seeing those upticks in some of those communities, what they've attributed through their, so as we do the interviews with the cases and we try to understand where their exposure might be and we do the investigations, they've tracked a lot of clusters to social gatherings. There was the party down at the Cape. They had football practices happening where people weren't social distancing and wearing face coverings. So there's a couple examples where they had large people gathering in large groups. So what the governor has done is decrease the amount of people that can gather outside from 100 to 50. The indoor gathering remains at 25, which it's been for quite a while, but the outdoor gatherings has been reduced to 50. And it's also expanded to all types of events, public or private. And the other thing is, even though you're restricted to those 50 people, social distancing and face covering is still required at those events, even though you're outside.
So as we wrap up here, people should continue wash the hands, masks. What else is the message?
Yep, so you want to maintain social distancing, wear your face coverings, wash your hands. The number one way the virus is transmitted is person to person. So those are really the key things that you want to look at, is the social distancing and the face covering and the hand washing, because that's how you introduce it onto your face and into your body, the virus. But also keeping in mind those things of cleaning high-touch surfaces, getting your flu shot. I'm going to add that into the mix because that's going to really help us as we go into flu season. So taking all those precautions.
Super. Well, Sigalle, we are so happy that you were at the helm here. Extraordinary times, but you have absolutely guided the town fantastically, and I want to thank you on behalf of everyone. And with that, we're back with Mark Hoover and Allie McDonough.